Hello guys, hope you're all okay and you're all enjoying your life, and again welcome back to Dr. Arshad Nadeem Awan Ultrasound and Radiology teaching video. Today topic is related to ultrasound, and that is microlithiasis, testicular microlithiasis. Testicular microlithiasis is a comparatively uncommon or rather rare disease, and it has multiple associated factors. But as far as the European Society of Radiology investigation is concerned, they recommended a particular criteria, that is 5 calcific foci within the field of view. If you see 5 calcific foci within the field of view on the ultrasound imaging, you will label this case as intraparenchymal testicular microlithiasis. As I mentioned, it's a rare condition, but still there are so many associations, like it will be related to testicular germ cell carcinoma, related to infertility, Down syndromes, and multiple other associations are there, which I will discuss in this video. Beside this, I have taken a clip of ultrasound imaging in which you will be able to see that there are multiple calcification within the testicular parenchyma. These are basically calcium depositions within the testicular parenchyma. So how we will appreciate that on the ultrasound imaging, how we will write the report, and how we will classify that, this will be included in this video, and I do hope that this will be worth watching. So let's start watching this video. So deposition of multiple tiny calcification throughout both testes is termed as testicular calcifications. The diagnostic criteria on the ultrasound is that there should be at least 5 calcification in one testis, and European Society of Urogenital Radiology suggests that there should be at least 5 calcifications in single field of view. Then you can label that case as a testicular microlithiasis. Testicular microlithiasis can be seen in 5.6% in general population, and usually the age in which microlithiasis can be seen is ranging from 17 to 35 years of life. 50% of testicular microlithiasis are associated with germ cell tumors. There are some other associations, disease association patterns with the testicular microlithiasis, including testicular germ cell tumors, cryptorchidism, testicular infarcts also contributes, testicular granulomas, infertility, Down syndrome, and alveolar microlithiasis are associated with the testicular microlithiasis. You can classify testicular microlithiasis into 3 categories. Number 1 is called as limited testicular microlithiasis, when there is less than 5 calcifications per field of view. You can also label it as a classic testicular microlithiasis if it is more than 5 calcifications per field of view. And the third is diffuse testicular microlithiasis, when there are numerous calcifications spread in the testicular parenchyma, then it would be called as diffuse testicular microlithiasis. On this testicular ultrasound, you can see in view there is a right testis, and within the right testis there are multiple calcified foci. So these are actually diffuse intratesticular microlithiasis example. In the view you can see there is testicular mediastinum, and you can also visualize the epididymis on the top. If you look throughout the area, so you will be able to see that these are more than 5 calcifications in field of view. So keeping the presentation and the number of the calcification in view, you will have to label it as a diffuse testicular microlithiasis. But here you can see that this is the left-sided testes, and in the left-sided testes there are less than 5 calcifications. So as per classification, you will have to label the left side as a classic testicular microlithiasis. So on the right there is diffuse testicular microlithiasis. On the left there is classic testicular lithiasis. So as you watch this video, and I do hope now the concepts will be clear regarding the testicular microlithiasis, and you will be able to confidently report which type of which category you are reporting this microlithiasis, testicular microlithiasis. But one thing which is very important, at the end of the report you have to mention that till what time this patient should be followed up. As per this European Society of Radiology recommendation, you should have to have yearly monitoring ultrasound or surveillance ultrasounds. So you have to follow the patients up after every year until the age of 55, because there is association and chance of developing testicular carcinoma. So for that matter, you have to keep eye on, and you must advise the follow-up scan after every year. So this is one very important point you must take into account. The second thing is, if all these other association which has been discussed in this video are present, so then you have to have the biopsy for that to be on the safe side. If the patient complains about the pain or certain feeling of lump or heaviness, so you must go for the biopsy. So I do hope this would be a worth watching video. Keep in touch with some other video. We'll see each other. Till then, take great care of yourself. Bye bye.